If anyone knows the many major and minor medical issues families face, it's Best Med Medical Scheme. In these mini episodes, we're taking on different issues with exceptional experts so that you can have top tips to look back on when you need them most. Today, we're talking all things pain and fever with Dr. Coopoo.
Thanks so much. I'm so excited to be here and talk about this topic.
Well, Dr. Coopoo, let's get right into it. What is the best way to take my baby's temperature?
Okay, so traditionally people used to check temperature rectally or in the mouth, but actually it's been proven that using a thermometer in the armpit is actually the best way to do it in terms of baby's comfort and accuracy. And if they're older, you can use an ear thermometer as well.
And why would a child or a baby have fever?
So fever, the most common cause is actually infections, which are from viruses or bacteria. And it can be any infection, chest infection like pneumonia, upper respiratory tract infections like throat infections or ear infections. It can be a urinary tract infection, and the most dangerous one is meningitis, which is an infection of the covering of the brain and the spinal cord.
When should I be worried about a fever?
So most fevers are harmless and resolve by themselves with a little paracetamol or medication. But you need to watch out if there are any signs of serious infection. So if your child complains of a very severe headache or have neck stiffness or they develop a new rash, other things are if they have severe earache, severe throat pain, and if the baby is breathing very fast and you see that they're struggling to breathe, their chest is going in with each breath, their nostrils are flaring, and they just look very unwell.
What are the best ways to treat a fever?
So you can think of it as medicine-based and non-medicine-based. So with medications, use it under the discretion of your pediatrician or doctor. And the main ones we use in kids is paracetamol or ibuprofen. So don't use both at the same time. You can try one. If the fever hasn't come down by 1 to 2 hours, then you try the other one. And usually the fever will resolve. The important thing is not to use aspirin for fever in children because it can cause a very rare but serious syndrome called Reye syndrome, which affects the brain and the liver.
Oh, okay, that's very important to remember.
And in terms of non-medicine treatment, you can distract the child, so play a game with them, maybe read a book, they can watch some TV. For a baby, you can swaddle the baby, give them a pacifier. And with older kids, get them involved in their own illness. Explain to them what's happening. They're often very scared of getting injections or having treatment, so explain the process and that it's more important to get better than worrying about an injection.
Okay, let's zoom through pain. Why would my baby be in pain? How would I know?
So with kids, it's much more subtle, especially since they can't really speak to us if they're young. So look at your child's facial expression. If they're all scrunched up, or the opposite, if they're blank, that's something to worry about. Look at their posture. Are they twisting in an uncomfortable way? Are they scared to move and holding still? You'll look at the child in terms of their irritability. Are they fussier than normal? Are they crying a lot or you can't calm them down? In older kids, obviously they can complain of pain and they can actually tell you how severe it is. But yeah, those are the main things to look out for.
In treatment of pain, is it the same as with fever?
Yes, it is. So you use the same drugs, paracetamol and ibuprofen, and you avoid aspirin as you do with fever, and give the doses according to the bottled doses and under the advice of your doctor.
Thank you so much, Dr. Coopoo. You've certainly taken the heat out of today's topic and made pain a little bit more bearable for our little ones. This has been Best Care, brought to you by Best Med Medical Scheme.